not only do you have to be healthy with your body, but there's also your mouth health as well with your teeth. I'm here with Dr. Andrea Joyce-Smith. How you doing?
I'm doing great, Al. How are you today?
Doing great. We're talking about receding gums and how to treat them. So talk about why should we be concerned about receding gums?
Well, receding gums should really be a concern, mainly because it can eventually lead to the loss of teeth. Our bone that supports the teeth, it is right under the gum line. So as the gum line recedes, the bone recedes right along with it.
Oh.
And so over time, because the bone that supports the teeth is no longer there, the teeth become loose and you can easily lose a tooth.
Oh, wow.
Or several teeth.
Yeah, it can be really bad. So, I mean, I know people are afraid to go to the dentist in general, but what can they experience getting this new type of procedure done?
Well, with this new procedure, it's actually a lot simpler than the old conventional way of grafting. So with this procedure, basically the patient comes in, they're numbed, and through tiny entry points, we use these specially designed instruments by Dr. Chow himself.
Okay.
And we enter those small entry points and we free the tissue from the bone and we move the gums into the proper position.
Oh.
And then at the end, rather than using sutures or stitches, we place collagen to hold everything in place. Unlike the conventional technique that we just saw there,
right,
where there's a piece of skin removed from the roof of the mouth and placed under the gums, the Chow pinhole surgical technique actually uses the specially designed instruments to gently free the tissue, and then at the end, like I said, we place collagen there to hold everything in place.
And that helps the attachment process, yes?
Yes, and then it reattaches to the bone as it should.
Oh, so how long does this procedure take?
It can take about an hour depending on how many teeth are being treated. The beauty of the Chow pinhole surgical technique is that we can treat the entire mouth in one day, or one appointment, I should say. Whereas with the old conventional technique, only 2 or 3 teeth can be treated. And with that technique, the main goal is not root coverage. And so if the roots aren't covered, the teeth look longer, they're sensitive to hot and cold, and the results are not immediate.
Oh, wow. So there's a lot of procedural work to be done, but it's done pretty quickly.
It's done pretty quickly. The recovery time is a lot quicker. The results are immediate. When you leave the office that day, exactly, when you leave the office that day, your gums go from being recessed to moved into the proper position.
So the whole thing is called the Chow pinhole gum rejuvenation. That's the full name of it.
Yes.
But how can someone find a doctor in the area that can do this procedure?
There's a website that Dr. Chow has sponsored. It's called the pinholerejuvenationtechnique.com.
Okay.
And you can go there and find a doctor near you.
Oh, nice. Okay. So, and I would imagine that you're one of the people that actually can do the procedure as well. Yes.
Yes, I was personally trained by Dr. Chow to do this procedure about 4 years ago, when he initially started training doctors. Yes.
Oh, nice. So you've got it right from the source. You can make it happen. All they have to do is contact you or contact Dr. Chow and get all the information there.
Yes, on their website, I should be listed as a provider. I'm here in Sacramento, so I shouldn't be very hard to find.
Oh, okay. Very good. So, hey, thank you very much, Dr. Smith. That'd be fantastic. So, we're going to get some information about this put them on the screen in a little bit, but talk about also the different procedures that you do on top of this procedure that you have.
Well, my practice is a general dentistry practice, so of course I do all facets of general dentistry, but I also do a technique called mini dental implants, which is really the more modern way of replacing missing teeth.
Oh.
It's a way that is less surgically invasive in the same way that the Chow pinhole surgical technique is also less surgically invasive. So in keeping with the trend of microsurgeries, the Chow pinhole surgical technique as well as using mini dental implants are both techniques that I pride myself on offering.
Very nice. Thank you very much, Dr. Smith. I appreciate that very much. Put the information up on the screen. Find out how you can get involved with this. Pinholeacademy.com. For more information, they'll call 626-308-9104.